I'm Dr. Jason Weisstein, and I'm new to Yavapai Regional Medical Center. My focus is orthopedics, and I am a husband and father of 2 children. We really enjoy spending time outdoors, which is really what drew us to the Prescott area. I was recruited here as a subspecialist to essentially broaden the specialization for patients who are in need of care related to their hips and knees. I have 2 children, one who is in college as a freshman in Colorado, and a daughter who is rapidly approaching graduation. She will likely leave us as empty nesters, and my wife and I discussed where could we spend the next 15 to 20 years of our life in a 4-season city, but with great recreational opportunities outdoors. Prescott was one of the places I had interviewed, and I really saw a need for somebody with my skills. Really felt great support from the hospital and administration. Coming from Colorado, I had lived in a desert alpine environment. This was very similar as well, and everything just kind of fit. I think I'm mainly drawn to orthopedics because of the fun we get to have with all of the really high-tech instruments and robots, but at the same time, we're able to use that in such a way to really positively affect people's lives, to get them back to the usual activities that they do. In my case, because I take care of largely knee and hip patients who need joint replacements, they're able to get back to golf, hiking, biking, and that to me is a great way to spend your day. Since I've been here, everybody at Yavapai Regional Medical Center has been extremely friendly, and there is kind of almost like a family feel here, which I think is great. You don't find that in a lot of big impersonal kind of academic powerhouse medical centers. So it really feels more like family here. Administration's very supportive, and I think they really have a vision so that people won't feel the need to leave and find their care elsewhere. At the Outpatient Services Building on the West Campus, we have a brand new state-of-the-art facility where we are rendering the best in orthopedic care possible. We have a new x-ray machine, we have state-of-the-art ultrasound, and we've assembled a team that will provide not only the best care, but really compassionate care that I think will make a lasting impression on patients. One of the other highlights of the Outpatient Services Building is the Physical Therapy and Rehabilitation Department. I actually had the privilege of meeting them last week and found out what a fantastic team they are and what extraordinary interventions and machines and techniques they have. Everything from more holistic approaches to more traditional approaches to getting patients back to doing the things they want to do. 2 of the unique offerings that I'm really excited about are robotic joint replacement and direct anterior hip replacement. There's a tremendous amount of interest across the country in having minimally invasive hip replacement. It's something that I've done for at least the past decade. There's about 10 to 20% of United States surgeons doing the procedure. I think what's important to know is that there is a very steep learning curve. One of the reasons that people don't do the procedure is because they don't want to learn something new when they're out in practice on 50 or several hundred patients. Thankfully, I'm off the learning curve, having done many thousands of these procedures. But I would say that in general, the anterior hip replacement for most patients is essentially an easy recovery, and these are my happiest patients by far. What I'm probably most proud of is being able to balance a very successful professional career with a great family life. I think now being part of Yavapai Regional Medical Center, there's a real commitment to producing great doctors, but also having a great balance and quality of life.